Welcome to the Legal Aspects of Dentistry, a podcast where dentistry and the law intersect, hosted by Olivia Wan. So grab your coffee, settle in, and join us as we discuss the legal side of dentistry, because a well-run practice isn't just about clinical excellence, it's also about smart legal protection.
Welcome to the Legal Aspects of Dentistry. My name is Olivia Wan, and joining me is Caitlin Dennison. And today we're talking about why should instruments remain packaged until point of use. Now, at the very onset of this discussion, I want to acknowledge the fact that 26 years ago when I started consulting, I found a lot of loose instruments in storage. In other words, when I would audit a dental office and I would open up the mobile carts or the drawers in the sterilization area, I would see a lot of loose instruments, and that's not the case anymore. Predominantly, instruments are packaged, but we still run into offices that are setting up the treatment room in advance of the patient being seated, and to save time, they are opening up the package and laying out the instruments in the order that they plan to use them. So we wanted to talk about those pitfalls, Caitlin.
Absolutely. We have to remember that once we open a dental instrument package, those formerly sterile instruments are exposed to whatever contamination might be in that environment. Dental treatment rooms contain aerosols, splatter, dust, and inevitably those instruments may come into contact with the surfaces of the dental treatment room. Even in a clean room, microorganisms can settle onto exposed surfaces or exposed instruments. Opening sterile instruments before the patient is seated creates unnecessary exposure time to those hazards and can compromise the integrity of the instruments before your treatment even begins. Waiting until the patient is seated and treatment is about to begin provides several important benefits. It helps, again, preserve sterility of those instruments for as long as possible, and it demonstrates visible infection control practices to the patient, showing that the instruments were sealed before for their protection. And I know Olivia knows this, but our patients notice these things.
They definitely do, Caitlin. And if they don't, we should bring it up. So instead of having conversations such as, are you enjoying the weather? Things like that, maybe we should turn the conversation to, did you notice that the packaging of your instruments that I'm about to use was sealed for your safety? Everything has been heat sterilized, and these little color controls show that they have passed through the heat sterilization. And so I think it's a good point to bring it up. And it does show your commitment to safety and your professionalism. And it communicates to your patient that infection control is taken seriously. You know, with all the AI, Caitlin, people could just go on AI and ask the AI, how do you properly sterilize dental instruments? And they've got information at their fingertips. So we want to make sure that we are bringing it up and we're actually doing what is recommended by CDC for proper infection control and prevention. And so it is critically important to allow the instruments to remain packaged until point of use, as Caitlin emphasized, for the contents to remain sterile. Thanks for tuning in, and we'll see you at the next episode.